Hey there, ever heard a strange click, pop or crack when you move and wondered, is that normal? Let's talk about what those joint sounds actually mean and when you should and shouldn't worry. What's that sound really? Well, that satisfying pop you hear sometimes when you stretch or move, it's often called a joint cavitation, and it's totally normal. Here's what's happening. Inside your joints, this is the back for example, there's a small amount of fluid that helps them move smoothly. When you move and the pressure in the joint changes, tiny nitrogen gas bubbles can form and collapse, creating a pop or clicking sound. Think of it as opening a bottle of sparkling water. Pressure change, tiny bubbles, quick pops. No bones grinding, no damage happening, just pure physics. When is clicking totally fine? Most of the time, that click, pop or crack is completely harmless, especially if there are a few things. There's no pain, you have full movement, the sound is occasional and not new or worsening. If you've just been still for a while, like sitting at a desk or waking up and stretching about, often it's just a gas bubble or sometimes a tendon flicking over the bone as you move. It can happen more often when your muscles are tight. When your joints are hypermobile, that's when they move more than average. So the muscles have to tighten up the joints to stabilise them more, causing them to get a bit restricted. Well, when is it not okay? Popping or clicking might be a sign that something's off when it comes to any of the following. If there's pain, especially if it's sharp, deep or lingers after the sound. If there's swelling or heat around certain joint. Grinding or crunching sensations, which may suggest the joint surface has changed or it's worn down. A stuck feeling, like your joint doesn't glide or move properly. Repeated catching or locking, especially in the knees or shoulders, and a new or worsening noise after injury. These can indicate inflammation, wear and tear, or mechanical imbalances in the joint, and they're worth getting checked. These may be signs that your body's asking for help, not just making noise. Here are a few things we check in clinic. Muscular imbalances and tightness, pulling a joint slightly off track and causing it to be restricted. Previous injuries, even old ones, can cause compensation patterns and tight joints elsewhere, which can then cavitate or crack. Joint hypermobility, so when your joints move more than other areas have to tighten up and compensate and get tight and can crack. Weak core or poor posture, especially around the hips, knees and shoulders, which can cause joints to be restricted. Inflammation, which may lead to a rougher joint surface over time. So why the joint is cavitating? Again, if your back gets a little bit tight and you start moving it in a certain direction, that's the gas releasing. So what can osteopathy do? Well, we're not here to just chase sounds. We look at how your joints move, what's created the tension, whether it's a bigger part of the picture. We assess your whole body, not just the noisy joint. We use gentle hands-on treatment to improve joint alignment, reduce tension and support stability in the joint as well. We also give you tailored exercises to support better movement and some strength as well. Sometimes that click is just a release, there's nothing to worry about. Other times it's your body waving a little bit of flag for attention. Our job is to figure out which one that is. So if your body is clicking, cracking, popping more than usual, or it just doesn't feel right, send us a message or book in. It might be nothing, or it might be your body's way of saying, hey, I could use a little help here.